Welcome to this first presentation from Health Justice Australia on how to start up a Health Justice Partnership. I'm Tessa Boyd-Kane. I'm the CEO of Health Justice Australia, which is the National Centre for Health Justice Partnerships. With me on this presentation are Katie Ronson from Justice Connect, Faith Hawthorne and Jess Eastwood, who are from Justice Connect and CoHealth respectively, Dr Nicole Woodrow from Royal Women's Hospital, Linda Gyorke from Inner Melbourne Community Legal, and Jess McCartney from Loddon Campaspe Community Legal Centre. Each of our presenters will be sharing with us this afternoon their experience of starting up a Health Justice Partnership and some of the challenges and opportunities that that work brings. Health Justice Partnerships are an expanding way of working that provide access to legal services through health settings. They're a response to evidence that large numbers of people have legal needs for which they will never go and see a lawyer, but which they are likely to talk about in the trusted environment of a health setting. This afternoon, we're going to hear from a range of presenters about what it is that they're doing through Health Justice Partnerships and help you think about whether this is a way of working for your community service. Health Justice Australia, the National Centre for Health Justice Partnership, is providing support to expand health justice partnerships through the development of evaluation and other research, through resources that support partnership, and by connecting the experience we're seeing within health justice partnerships to lasting change through systemic advocacy, policy and program reforms and other ways of helping ensure that our human services better meet community need. Throughout this presentation, if you've signed in through a Google account, you'll be able to participate in the online chat, and you'll also be able to receive information about the things that we're talking about, including resources that can help you further through that online chat. That concludes the introduction to this presentation, and we'll move now to hear from our presenters. So Jess from Loddon Campaspe Community Legal Centre, working in a Health Justice Partnership with Bendigo Community Health Services. Tell us a bit about how you established the Health Justice Partnership in Bendigo.
So we were generously granted a fellowship from the Clayton Utz Foundation to be able to research medical legal partnerships and the advantages of them. As part of that fellowship, our former executor officer was able to travel to the US to conduct research into them. Out of that, it was seen that there were significant advantages, and it was decided that a pilot would begin in Bendigo. So based on the US, a crucial component of establishing a health justice partnership is building relationships with health service providers in the region and identifying a primary partner and operational model and an area of focus for the project. So in doing that, there were two major stages of that. So the first was scoping. So in order to scope who was the most sufficient partner, we engaged a project development worker in 2013 for 6 weeks. 6 months, my apologies. And she researched many different health organisations. I think there was 4 different organisations, and it was identified that the Bendigo Community Health Centre was the most appropriate one. So we had shared philosophies with the Bendigo Community Health Centre, both focus on disadvantage and poverty of clients. So with that shared philosophy and key champions at Bendigo Community Health Centre, we decided that that was the most appropriate one. So there was quite a bit of research and effort put into identifying who would be the most suitable partner for us.
Thanks, Jess. And have you formalised your partnership in some form of document or other agreement?
Yeah, so we had a 3-year project. So it was funded by the Clayton Utz Foundation. So after the scoping, the second stage of that was actually implementing that. And that was through recruiting a lawyer, and the project was to go for 3 years. So to formalise that, we had a memorandum of understanding, and that's how we formalised the partnership.
Thanks. Does anyone else have anything they want to add about establishing a health justice partnership? And do you have any advice for people about funding and sustainability once you think you've got the makings of a partnership?
Yeah, I think in terms of funding, we actually did evaluation of the project, which was wonderful, because that can show the benefits of the partnership and help in funding applications. So I think getting that evidence to support the benefits of the Health Justice Partnership and what you're doing is important. And also just looking at key players out there who would invest in there and looking for any opportunities. So we were lucky enough to be granted funding from the Clayton Utes Foundation for this project. We have been granted some additional funding, and now that the project is finishing, we're working around how we're going to continue working with that. We may need to limit our service providing there. Yeah.
That was Jess McCartney from Loddon Campaspe Community Legal Centre, working in a health justice partnership with Bendigo Community Health Services. And that concludes this part of the discussion on the establishment phase of a health justice partnership. So, do you want to come forward? Mm-hmm. If you step back, Jess. Thanks. Come forward. In this discussion about establishing a health justice partnership, we're joined by Linda Gyorke from Inner Melbourne Community Legal and Dr. Nicole Woodrow from Royal Women's Hospital. We'd like to hear from you about some of the ethical challenges that you might have experienced in your work in a health justice partnership.
Sure. So most people, when they think about health justice partnerships, they think about collaboration, they think about working together, health professionals and legal professionals working together. But obviously there are some ethical barriers to working collaboratively as a care team, and those are predominantly legal professional privilege and the confidentiality that health professionals have around their clients' medical records as well, and how to overcome those. Another big barrier, especially in developing a health justice partnership with a major metropolitan hospital, is that you can sometimes, especially in the embryonic phases of a project, be forgotten. And so you want to be providing the hospital with case studies and information about the work that you're doing, but obviously you can't provide that feedback to the referring practitioner without the client's consent. So what we have done is we've introduced into our intake sheet for all clients that we see across the 3 hospitals that we partner with, a question where we ask every client whether or not they consent to us informing the referring practitioner whether or not the client attended the appointment and whether or not we could provide assistance to that client. And if we require further collaboration with the referring practitioner, we then ask the client to fill out a full consent form, and we would then, provided it's in the best interest of the client, go back to the practitioner and seek further information in relation to the patient or the client's details. Is there anything you want to add, Nicole?
Absolutely. Hi, Linda.
Hi.
So I guess the difficulty for healthcare practitioners, and I think this was witnessed in the beginning at Royal Women's, was having to create trust and faith between us, and not just also understanding that the Health Justice Partnership was present and aware. And initially, when doctors and nurses hear about lawyers in a hospital, there's always a fear of medical negligence. And that's something that was very well handled, I believe, at the Royal Women's, where it became very, very clear the importance of social determinants in health had to be discussed openly. And in fact, that is part of the work that isn't done within a health justice partnership. Our social workers at the Royal Women's are respected for their fantastic work as the experts in social determinants of health, and they've been the conduit for healthcare practitioners, for the midwives, nurses, and doctors. And they were initially the referrers when it all started, but now they really act as a conduit when queries come up from the workers in the hospital. And it's very important on the front line to have information about your health justice partnership championed among individuals who really believe in it and agree with it. And I think that's happened well at the Royal Women's with lots of workers.
And I might just add to that we've got a dedicated hospital phone line at our legal service. So we know if that phone is ringing that it's either a patient from one of the hospitals or it's a staff member from one of the hospitals. And often staff members ring asking for what we call secondary consultations. So they've, an example of one of the calls I've received is from a social worker who said, my patient's told me that they're on bail. I'm not really sure what that means. Could you just explain that to me? And it's just a matter of providing some information about the definition of bail, really, so that they can provide that information to their client. But obviously, we need to be very clear that they can't provide legal advice, only legal information. And if we determine that advice is required, then we'll book that client in for an appointment to see us for that further advice. And I might also say that in relation to providing that feedback loop, provided we determine that it's safe for a client to provide their case study, and provided that client obviously consents to providing their case study on a de-identified basis, we often do seek consent from clients once we've closed their files to provide de-identified case studies, so that in the hospital-wide newsletter or when we're talking to practitioners, we can say, look, I can't talk to you about this specific client you've referred. However, here's an example of a client that we've been able to assist who's been in a similar scenario, provided that client's consented.
Thank you.
Thanks very much, Dr. Nicole Woodrow from Royal Women's Hospital and Linda Gyorke from Inner Melbourne Community Legal. And that concludes this part of our presentation on ethical challenges in health justice partnerships. In the next part of our presentation on establishing a health justice partnership, we're going to hear about some of the practical challenges that people have experienced. And joining us, we have Faith Hawthorne from Justice Connect and Jess Eastwood from CoHealth, who are working on a health justice partnership addressing people at risk of or experiencing elder abuse. I will take this time to remind those who've joined us online that if you've signed in through a Google account, you can also ask us questions through the live chat function. So can you tell us about some of the practical challenges that you've experienced through your health justice partnership?
Sure. I think probably one of the main challenges that we've seen at CoHealth is CoHealth is quite a large organisation. It has lots of different sites, and how we've established our services, I receive referrals from a whole range of different teams. So really the key for us is trying to get the word out as quickly as we could that there's a lawyer on site and it's available to all clients who come through CoHealth. So I know, Jess, did you want to speak about some of the communication that we did with the service?
Teams. So
yeah.
Faith attended a range of different teams meetings to
Yes.
talk about the project.
Yeah.
We also tried to really share the information as much as possible on our intranet and on our e-news.
And Yammer.
Yammer as well.
Yeah, like an internal social networking site.
Yep.
Yeah.
And Faith's also based within our multidisciplinary team, but she's located at other sites. So that's a big way that she can actually be spread across our sites, because we are based across the CBD of Melbourne and northern and western suburbs.
Yeah. And I mean, the data from the first year was telling us that people were more likely to engage with the service if they're actually located at the same site that I was at. So we made the decision in the second year we would go from Footscray site out to Collingwood, and we've subsequently seen an increase in referrals from the Collingwood site. So I think co-location is obviously a really important element of the partnership. Another really important element is doing professional development. So that's things like identifying legal issues, how to work with lawyers, so some of the professional obligations associated with that, and then supporting that professional development with secondary consultations and being a little bit more flexible in how we work with clients and how we meet with clients and workers together.
Yeah, I think definitely from a health perspective, getting our head around what privilege is really important.
Yeah, because often, I'll meet with workers and say, do you have any clients with legal issues? And they say, maybe a fine every now and then, but not a lot, or maybe a court date. But then I'll go and do a couple of hours training on what legal issues might look like, as a life problem. And then, the feedback is sort of like, oh, that happens all the time, but I've never really known what to do with that. Yeah.
And so can you tell us a bit about the flow of clients through the service? Has it been a challenge, or have you had lots of demand from the beginning?
It's definitely increased a lot in the second year. Over the last quarter, we've seen a 250% increase in clients. So it's really picked up in the second year and recently. But in the first year, we didn't have there wasn't a huge emphasis on getting clients through the door quickly. We really wanted to take time, making sure that we had our policies and procedures right. We had relationships and we were able to develop trust with the different teams. So that was really more of an emphasis for us in the first year.
And I think secondary consults have increased as the projects also come into the second year. And that's really when the more meeting Faith attends and the more PD that she does, the more that you get a phone call.
Yeah.
At this stage, do any of our other presenters have things to add about practical challenges they've experienced with their health justice partnerships?
So I'll add to that. So you were saying it increases the relationship when on. One of the challenges that I found when I started, because we had a 3-year partnership, so we had one lawyer, Nikki King, she was doing the partnership for the first 2 years. Then I came on in the third year. One of the practical challenges of that is establishing that trust. It doesn't happen straight away. It does take time of being located out there, meeting the health professionals. It might be at the photocopier, it might be in the lunchroom. It does take time to get that relationship and that trust for them to then refer the clients. And again, that's developed by attending team meetings and staff development days and getting involved in the organisation. One of the other things is, so Bendigo Community Health Centre has an internal system called Track, which is an internal booking system that we don't have access to because of confidentiality. But I guess that's easily got around. So we just took referrals by email and health workers calling up. But definitely in time, the partnership does increase and the momentum happens because health workers, once you gain the trust, health workers talk to each other and that confidence is built. So it's great once it's going. But the initial starting up, it does take time to develop that relationship.
Thanks, Jess.
Nicole. Yeah, I just follow up on that I realised a couple of years ago that there were lots of healthcare practitioners who didn't know about what I consider to be a very established HJP at the Royal Women's. And so I did a straw poll of sort of junior doctors I was training, and I was surprised that they didn't know it existed. And so I went and talked to our social workers and said, how do we disseminate information? A lot had definitely been done by the executive. There were lots of formal, informal meetings, but for the front line, almost all of it is word of mouth. And you actually want good word of mouth. You want people saying positive things rather than anything else. So what I determined to do was I wrote an article for the Voice of Ranscog, which is our industry sort of magazine. And I wrote it with members of the executive of the Women's and also with Linda. And I was amazed that this sort of coffee table publication had far more effect within my industry than a lot of the other more formal things that had happened. So I highly recommend any of the healthcare workers to use these really rather rapid ways of just disseminating information.
Yeah, I might just add to that, just little things as well to make sure that you're embedded as part of the fabric of the hospital, or of the health centre, like getting an email address so that you can see where what people's diaries are doing, and you can arrange meetings and you become more of a part of the team. And it's a really unique idea to have a lawyer in a hospital, and people who are dealing with big patient loads don't often think, oh, does this client have legal issues? And we're really asking them to take that next step. And one of the ways to do that is to remain visible. And that could mean putting ads on the TV screens in the waiting areas, putting flyers in lifts, just getting, putting screening tools, are you seeing patients who have got fines, or are you seeing patients who have disclosed family violence to you, and putting those flyers and things up around the hospital and in the lifts and in really visible places so that people remember. One of the things that we did as part of our partnership was develop notepads, sticky notepads, and notepads for doctors to just and all health professionals to write notes on, so they could just keep it on their desk, and it reminded them about the legal service, and if they scribbled a note on it, they could either be reminded of it, or if the patient they were seeing required a legal appointment, they could rip it off and give it to the client. So just keeping the word out there as much as possible, I think, is really important.
That concludes this part of our presentation, talking about some of the practical challenges of establishing a health justice partnership and some smart ways to get around those challenges.
Thank you.
In the next part of this presentation about setting up a health justice partnership, we're going to talk about how you measure and demonstrate effectiveness. So we're joined again by Dr. Nicole Woodrow from Royal Women's Hospital and by Linda Gyorke from Inner Melbourne Community Legal. And I'd like you to kick off by telling us about evaluation and what have been some of your approaches, and whether they've worked in this very new space of partnering between legal and health workers.
Sure.
Get you to kick that off.
Sure, no worries. So we're in the process of doing our second evaluation. The first evaluation we conducted was between 2012 and 2014 for our work at the Women's Hospital, and it was done by Melbourne University, and in particular by Professor Kelsey Hegarty, who's a Professor of General Practice at Melbourne University, and Professor Kathy Humphreys, who's a Professor of Social Work. And they were part of our health justice partnership at the Women's has also been to provide training on the on identifying and responding to family violence, and we run a full day study day at the Women's Hospital called the Acting on the Warning Signs Study Day. So a key component of that evaluation was evaluating the training specifically and whether or not it had an impact on the practice of frontline health professionals in responding to disclosures of family violence. But they also looked at the Health Justice Partnership and the impact that it was having. And if anyone wants to read that report, I'm very happy to forward it to them. We're now conducting a further evaluation. Our evaluation officer at the legal service is evaluating our work at the Women's Hospital. But this time we're fortunate that we've also developed partnerships with the Royal Children's Hospital and Royal Melbourne Hospital. And so we're conducting a cross-site evaluation across the three hospitals, which is looking at a number of different things, but predominantly at whether or not the clients that we see at the hospitals would have seen a lawyer had the lawyer not have been on site. And if not, why not? And whether or not the legal intervention has had an impact on the client's health or wellbeing. And that report will be available probably around March next year.
The evaluations are really important, obviously, for health professionals. They're really important for funding, as a rationale for what's going on in the hospital, for future research directions. And certainly in terms of the education sessions that was evaluated by Professor Hegarty, it was very important. It all became part of an accreditation for junior doctors and midwives and obstetricians. And in fact, the Royal Australian College of Obstetrician Gynecologists gave us some lovely continuing education points for that. So that was obviously high standard, and it's vital. Audit of this sort is absolutely vital.
I might make a very quick point. I think what we wanted to do in the initial stages is meet with the partners and our evaluator and other key stakeholders to make sure that we had a really clear idea of the objective measurables from the start, so that we could collect information throughout the 3 years. So we knew what it is that we wanted to get information on.
I might also just add that if you are doing an evaluation through a hospital, or your evaluation requires ethics approval, which all of our evaluations have required, don't underestimate the amount of time ethics approval takes, and make sure that you allow yourself plenty of lead-in time to account for that as well.
Yeah.
And that concludes this part of our presentation, talking about the critical role of evaluation in health justice partnerships. Do you want to come and join us? Yeah, sure. And Jess, do you want to come up as well and maybe talk a bit about the other cases? In the final part of this presentation, talking about setting up a health justice partnership, we're going to hear from some of our presenters about how they've connected the work of providing legal services in health settings to opportunities for lasting change through policy and advocacy. So, Faith, has there been work that you've done between Justice Connect and CoHealth that's really had that opportunity for lasting or systemic change?
We have done a little bit of joint advocacy. Earlier this year, there was an inquiry, or they've established an inquiry into elder abuse, and that was through the Australian Law Reform Commission. And there was a whole range of issues that the inquiry was looking at, but there was one chapter dedicated to health services, and two of the key things that they wanted to look at was how could we support health professionals in addressing elder abuse. And our health justice partnership is focused on addressing elder abuse. And the second thing that it wanted to look at was what is the value of health justice partnerships. So both Justice Connect and CoHealth prepared a submission responding specifically to that chapter, addressing those particular issues. So the inquiry is still going on, so we'll have to wait and see what effect that will have.
So one policy work we did a little bit of work on. Actually, this was done just before I started by the health justice lawyer before me. So I was assisting people who had a disability, and as a result of those disability, they had their children taken away from them. So there was a joint submission with Bendigo Community Health around that, and getting case examples and working around that. I'm sorry, I don't know a lot more detail in relation to that because it was prior to when I came, but we're always looking out for different opportunities. I believe there was law reform about people who had autism and the disadvantages there. So I spoke to some workers at Bendigo Community Health Centre around their examples and experiences around that, and the barriers that people with children that have autism face. So there have been some examples where we've done that, and we're always looking out for opportunities. And the great thing about Bendigo Community Health Centre is that we have key champions at senior level management who are always supportive and willing to do policy change and other things as well.
Have we got anything from other presenters that they'd like to contribute?
I might just add. I might just add that we've prepared a number of law reform submissions arising from our work in health justice partnerships, but I suppose most notably we prepared a submission to the Royal Commission into Family Violence, and we then gave evidence at the Royal Commission in collaboration with the Women's Hospital. So the Executive Director of Clinical Operations, as well as a midwife from the Royal Women's Hospital, as well as I, provided evidence in relation to a number of factors. But obviously I was talking specifically in relation to the health justice partnership that we provide there, and the way that a free embedded legal service can have an impact on women experiencing family violence in particular. Another systemic issue that has arisen out of our work at the Women's Hospital has been a number of queries around birth registration statements. So we have had a number of women attend our legal service at the hospital who have asked us about a number of questions arising from the birth registration process. And had we not have been embedded at the hospital, I don't think that volume of questions would have come to us as a general legal service. And as a result of that, we've been in a fortunate position to be able to advocate on behalf of those women to a number of different places. We've written letters to the Attorney-General. We prepared a submission to the Victorian Law Reform Commission when they were reviewing the birth registration process a number of years ago. And we have had some discussions with the Registry of Births, Deaths and Marriages about how the process might be seen to be more straightforward for women who have got queries around the birth registration process, and in particular for women who are experiencing family violence. And those conversations are ongoing.
Anything else? Thanks, Ms. Watt. Please. And that concludes this part of our presentation, talking about the connection between practice and lasting change through policy and advocacy that is being achieved through the work of health justice partnerships. We hope you found this discussion useful. Health justice partnerships in Australia have been evolving since 2012. We've now got more than 20 of them around the country. If you visit the Health Justice Australia website, you can see where those health justice partnerships are located already, and perhaps as importantly, see some of the gaps that are waiting for partnerships to spring up from community organisations, from health and legal services, and from others who are willing to support this really important way of bringing health and legal services together. Many of the information that you've been provided through this presentation is available through the Health Justice Australia website. That web address is www.healthjustice.org.au. There you can find information about evaluations that have been conducted. You can find videos from some of our star presenters and others who are working in health justice partnerships, and a whole range of other related resources that are there to support people interested in this way of working. This afternoon in this presentation, we've been joined by a range of people working in health justice partnerships. They include Linda Gyorke from Inner Melbourne Community Legal, Dr Nicole Woodrow from the Royal Women's Hospital, Jess McCartney from Loddon Campaspe Community Legal Centre, Faith Hawthorne from Justice Connect, and Jess Eastwood from CoHealth. I'm Tessa Boyd-Kane, CEO of Health Justice Australia, and we look forward to joining you again for more support to expand the really important work of health justice partnerships across Australia. Thanks for joining us.